Hello, everybody. So, we'll be discussing a very interesting thing, that is when to start an anti-epileptic drug. Now, it's a very important problem and we very commonly face. So, when to start an epileptic drug, anti-epileptic drug? Now, see, any patient who is presenting with status epilepticus has to be put on the anti-epileptic drug, and most of the time these patients need this anti-epileptic drug for the rest of the life. Now, when do we label it as a status epilepticus? Whenever a patient has convulsions which is lasting for continuously more than 5 minutes, or the patient, if the patient has continuous convulsions which is lasting for more than 30 minutes, where the patient is getting repeated convulsions and he is not gaining consciousness in between, we label it as status epilepticus. So these are the thing where we label that the patient has status epilepticus. So any patient who is presenting with status epilepticus has to be always put on anti-epileptic drugs. The other thing is any patient who has a family history of epilepsy. If someone has family history of epilepsy and if that patient present with convulsions or seizures, then definitely such patient has to be started on anti-epileptic drugs. Any patient who is presenting with more than two convulsions has to be put on the anti-epileptic drugs, and then indication of the continuation of the anti-epileptic drug has to be definitely thought of. The other indications which are there to start an anti-epileptic drug is any structural brain defect. So, any structural brain defect where the patient present with convulsion has to be put on anti-convulsion drug. So, if someone has cortical venous sinus thrombosis, or someone has stroke, or someone has glioma, or someone has gliosis, or someone has glioblastoma multiforme, so any patient who has any structural brain defect, such patient, if they present with convulsion, they must be put on anti-convulsion drugs for rest of the life, and it is very much necessary. Any patient who undergo neurosurgery also then automatically gets a brain injury, and such patients are at a very high risk of getting convulsions again and again. So automatically such patients who undergo any neurosurgery, like for a head injury or for intracranial hemorrhage or any brain tumor surgery, such patient has to continue the anti-epileptic medicines for rest of their life. If someone gets a convulsion and if they have a high risk job, like if the patient is pilot, or if he's a bus driver, or if he's any type of driver, then such patient, if such patient gets convulsion, then definitely the risk of harming himself as well as to the large people uh, of the society can be definitely there. So such patient also need to be put on anti-convulsant drugs for rest of the lives. So any patient who has an abnormal neurological examination, and if such patients get convulsion, then such patient must be put on anti-convulsant drug. So these are almost all the indications of starting an anti-epileptic drug. If you have any query, please feel free to comment, and thanks for today.